Cats, by nature, are masters at hiding pain. Digitherm and Assisi Animal Health are committed to helping you diagnose pain and inflammation in your patients while providing you with an effective, non-invasive, non-pharmaceutical treatment option.
Hello, I'm Dr. Jeff Smith. I'm here with Dr. Elizabeth Colleran from the Chico Hospital for Cats. We're discussing cat pain, how to score it, how to see it, and how to treat it today.
Painfreecats.org has the Feline Musculoskeletal Pain Index, and there you can find an easy to read and fill out questionnaire that's based on clients' knowledge of their cats. And so it's written in an easy to read format. The clients can fill out the behavior questionnaire that isolates pain source and how the cats are doing over time.
This portion of the talk, we're going to talk about thermal imaging. I think a lot of veterinarians are familiar with radiographs, ultrasound, and MRI even, but perhaps didn't learn about thermal imaging in vet school. The technology has really advanced and changed a lot in the last 5 years. Very easy to use. It's usually technician administered and doctor interpreted. And I think it meshes really well with the idea of trying to incorporate a feline pain management index. So that's a objective standard that an owner would fill out, and this is a way to visually confirm and monitor the types of therapies that you're going to be instituting at the clinic for your cats. I have a couple of examples here that I'm showing. One is on a thermal camera of a cat that I imaged yesterday, and so basically what we're seeing here is a lack of circulation. A lot of times people are concerned with inflammation or excessive circulation, but we see in geriatric cats quite a bit a lack of circulation in the parts of the body that they're not using the way that they used to. We know that most cats over, say, 9 years old have demonstrable arthritic changes. So here's a way that you can help owners to objectively see that. And then if we institute therapy for this cat, hopefully we see that improve and change on subsequent visits. I had another example on the computer here of a cat with some arthritis in the knees, and so this is the more classic example of the increase of circulation or inflammation. You see an increased thermal gradient over both stifles there. So I just wanted to pose those sort of two opposite kind of examples. Does it seem like that would make sense with the feline pain management index?
It does, because you can't tell in cats. You just know that there's something wrong. If they fill that form out and the cat is jumping differently or whatever, you can't really isolate exactly where. And this looks to me like it does exactly that.
We're going to talk specifically about targeted pulsed magnetic field therapy as provided by the Assisi loop.
We think this is a great addition to our repertoire in multimodal pain management, because cats hold grudges, and so there's a needle that we thread as feline practitioners between the relationship and preserving that of the human with their beloved cat and the fact that the cat needs to be medicated for their pain. And with this, I just slide it under the bed and the cat will stay on it. We can do 2 or 3 treatments a day for cats that are in more discomfort. And then we have the loop lounge, and this is a carrier with an Assisi loop in it. And so the cats that like to hide, that like to be in a quiet place, they can go in their little loop lounge, get their treatment, and come out with whenever they're ready. And so it's just a matter of pushing the button, getting the light on, and 15 minutes later, this amazing treatment is done. Use it for all kinds of things because there's basically a big area that is treated around the loop, so the loop doesn't necessarily have to be right on top of the pain. So we can have it sitting right underneath the bed or in other ways so the cat doesn't mind it. And so we treat almost everything, including dental extractions, post-operative pain, chronic pain, all kinds of things. And of course, every cat over 9 years old has osteoarthritis.
Exactly. So, the other thing I think is nice is the loop lounge treats the whole body of the cat. And so if you have a cat that's dodging where you want them to lay with the loop, if you put them in the loop lounge, their entire body is treated. And also, you mentioned the loop pads that we have for post-op treatment and recovery in the hospital.
We use those in the hospital for every patient. It ends up in their enclosure, and there's a big enough circumference of treatment area that the cats don't need to even be that close to it. And so if they have dental extractions, their head doesn't have to be on the loop, it can just be in the general vicinity.
Right. And I know that a lot of general practitioners are sort of waking up to some of these non-pharmaceutical anti-inflammatory devices. They're not just relying on pharmaceuticals anymore. You know, Dr. Payton at UC Davis and Dr. Troy at the Mueller Rehabilitation Center are big fans. So we really appreciate hearing from a cat specialist and seeing this out, you know, in Main Street USA, where we can get it into the hands of people that are interested in, you know, this multimodal approach and maybe trying to get their cat on less pharmaceuticals rather than more.
And preserving the relationship, that's a big part of it.
Yeah, exactly. So anybody that's pilled a cat or tried to give it any medicine should appreciate this type of therapy. Okay, thank you.